So we've got Raywat Deonandan. He's an associate professor in epidemiology at the University of Ottawa, and I love him for several reasons, even though I haven't met him. But he's been doing social media on appearing tonight. And the reason I love him, think of him as a brother, is because he's got at least one dog. And he was very worried that this would be a TV interview, not a radio interview. And if it had been a TV radio interview, the dog would have created a fuss. And so he's glad to be on the radio. Before we do anything else, Professor Deonandan, what's the name of your dog and how's your dog doing right now?
His name is Sherlock. He's asleep behind me, but earlier tonight he did knock over the background in a live TV interview, like caused some chaos. So I can never know what he's going to do.
Well, radio is much more intimate. I'm pro radio. I've done lots of television, but I'm a radio person. I've got a face for radio, and I'm just so glad to have you here. And I'm glad that Sherlock is not going to disturb anything. He's in a very, very good space right now. Professor, we're bringing you on because of this important subject. I think you know that some Canadians have the feeling that, hey, we're not spending enough or doing enough to make sure that we get vaccines as possible. Why would a professor or Adler or anyone else ask us to think about the world? So I just want to give you the platform right now to give us the big picture on where the pandemic goes in the next 6 months, the next year, the next couple of years, and how we may have a very, very difficult scenario to deal with if we don't make sure that the vaccine gets into the hands or gets into the arms, as it were, of people around the world.
Ooh, that's a really big question. So first of all, there's a couple of ways of thinking about this. One is, what's the humane thing to do? And the other is, what's the strategic thing to do? And luckily, both questions have the same answer. That is, we make sure that the world gets immunized. So the humane thing to do, obviously, is to reduce as much suffering as we can around the world. So if we have that capacity, of course, we have to make sure that the people in the darkest corners of the world who haven't got the money and capacity to work from home or to keep their kids home from school or to take a day off work and who can't afford a vaccine must get it. Strategically, it makes sense because no one is safe unless everyone is safe. As long as the disease is simmering in some corner of the world, it's not eliminated or eradicated and can come back to haunt us. So what does that mean for things like global trade or global travel? So many of our supply chains, many of our relationships in terms of a global economy are with countries that really suffer heavily with this disease. We want to see them on their feet for our own economic wherewithal. That's a very selfish way of looking at it. But also, if you want to travel to those countries or have them travel to us, in order to have a reduced restrictions, we probably won't be prevented from traveling there, but there may be some quarantine still required, some mask wearing, some documentation issues. To reduce those burdens, we need to get those places vaccinated. But I prefer the humane view, obviously. It's just the right thing to do. Pandemics don't go away on a national basis. They go away on a global basis. And so this is a global effort, and we're all in it together.
Okay, so I don't want to do devil's advocacy. If that's what it sounds like, you can stop me, but I just need to get a sense from you as to what we're talking about. So I'll just use our own North America, South America paradigm as an example. If we're trying to deal with the pandemic in, say, Canada, the United States, and Mexico, that's all of North America. If we have a problem in countries like Central America where there's a great deal of poverty, I'll just use El Salvador as an example, okay? If El Salvador has a difficult time dealing with the pandemic, does it affect Mexico, the United States, and Canada?
Of course it does, because cases will seep over. Not just cases, but insecurity and instability will cause some tension at the borders. And anytime there's a devaluation of proper living standards in an adjacent country, that affects us in many geopolitical ways, in ways in which I'm not qualified to comment on because we're deviating from the epidemiology of it. But people are probably thinking, we have a vaccine now. Can't we just vaccinate ourselves and be fine? It's not that simple, unfortunately, because our best vaccine so far is about 95% effective, so you can get the shot and have a 5% chance of not being protected. So you travel to one of these countries, you come back, and you're infected or infectious. And that's the other half of this. We don't know yet if the vaccine prevents transmission. It probably does, to be honest, or at least to some extent, but the extent to which it does is unknown. So it is entirely possible to be vaccinated, to go to one of these high prevalence countries and still bring back infection that will make its way into the unprotected aspects of our society. So there's still going to be danger of cross-contamination so long as the disease is highly prevalent in some pockets of the world.
Based on how conscious all of us are of the pandemic, and not just as individuals, but countries, governments, public health officials, doctors, epidemiologists like yourself, it goes on and on and on. Don't you think that various governments, including, of course, we can focus on our government, in this case, the national government, wouldn't the Canadian government warn us about countries where the pandemic is still a problem so that we would not travel to those countries?
I think so. But again, what's the cutoff? Is it based on an incidence rate of this amount? Is it based on a test positivity rate of this amount? Or in some countries where they don't do very good surveillance, we don't really know what the burden is. So it may be that there's a country with a moderate burden of COVID still simmering that maybe doesn't trigger Health Canada's travel advisory or GAC's travel advisory, but still you have a good chance of being infected. So there's a matter of scale, and it's a sliding scale, so it's hard to say exactly what would happen. But even if you're advised not to go, there's still going to be people who need to go to these places for business purposes, for example. So the question is, what kind of precautions are put into place for that kind of travel? So my point here isn't that travel is going to be outright excluded or banned. It's going to be different for some time, and it's going to continue to be different so long as we do not make efforts to make sure that all of the world is immunized.
Are you concerned? And if you are, I just wonder if you could name some countries, and if it's an unfair question, once again, you can stop me. But among the major countries that most Canadians travel to, and some Canadians, of course, travel because they're tourists. Many other Canadians travel because it's their heritage. We've got one of the most diverse countries in the world, so we've got people here from all parts of the world. Are there any large parts of the world that you know of where we've got large sources of immigration to Canada where vaccination is going to be a problem?
That's a really interesting question. So if we look at where COVID is most prevalent right now, of course, the USA is number one, India is number two, Brazil, Russia, France, Turkey, UK, and Italy. Now, of those countries, they're more or less wealthy-ish countries that have access to the vaccine. And the USA is the wealthiest and probably has the most access, but their administrative wherewithal has been questionable the last little bit, and it's unclear if they're going to be able to distribute that vaccine in a strategic manner in such a way to get maximum and most optimal distribution. India, I'm concerned about. Of course, 1 billion people, and they do have access to several vaccine formulations, and there is a plan for distribution, and the world's biggest vaccine manufacturer, the Serum Institute, is there. But I don't know how they're going to distribute it well, especially into the dense slum areas. That has me having some concerns. So when we get down to the countries that are really problematic in terms of their ability to manage the epidemic, we're into Iran, and Iran is having some issues accessing vaccine via COVAX. So COVAX is this global initiative where rich countries are allowing the poor countries to purchase vaccine doses from a common pool. And Iran has a very high COVID burden at the moment. But all this is shifting beneath our feet all the time, so it's unclear what's going to happen. In general, poor countries in the traditionally poor areas are going to have issues. And even countries that have some wealth associated with them, like Brazil and Russia and India, have such extreme wealth disparity that large swaths of the country may have access issues.
So I wonder if I could just in a minute or less get you to tell me what specifically are you asking for from Canadians at this national kitchen table tonight? Specifically, what is it that you're looking for, Professor?
I'm looking for, don't make hasty travel plans based upon your vaccination status. Or if you do, make sure that you are prepared to still follow public health restrictions when traveling there and traveling back. That means be prepared to quarantine when you get there and when you come back. Be prepared to wear masks and distance even while you are supposedly immune, because we do not know if you are still going to be a carrier. Right. So I have friends, for example, who are looking forward to vaccinations. They can vacation in the Caribbean. Okay, fine. I can't stop you from doing so. But be prepared that when you come back, you should be quarantining. even though you are likely immune.
Professor, thank you so much. Is Sherlock still sleeping?
He is amazingly asleep behind me, right? He's looking at me with a curious eye.
Well, so we're not disrupting Sherlock and your household. I hope you'll come back. You've been a font of information. Appreciate it very much.
Thank you very much. I had a great time.